Good morning, everyone. And I want to invite you to join us while we have a conversation with Dr. Susan Mayne, who is director of the Food and Drug Administration's Center for Food Safety and Applied Nutrition. Dr. Mayne Fair greatly appreciates you being with us today and for sharing insights and plans related to food allergens. We know CSFAN has lots going on related to food allergens at present, and our community really appreciates the agency's dedication. So to kick things off, first question for you. When in your career did you first encounter food allergy as an issue?
Thanks, Bob. First, I want to say how great it is to be with FAIR once again. We really appreciate the good working relationship we have had with your organization. I always learn from hearing from FAIR about important issues that can help guide FDA's work. I have been aware of this issue from a scientific perspective for decades, given my training in food and nutrition, where food allergy and food intolerances are part of our training. But there's also an anecdote I can share with you from my days in graduate school. One of the leading experts on food allergies is Stephen Taylor. And when I first started publishing my own research in the 1980s, I used my maiden name, S. Taylor. However, that meant that both of us were publishing under S. Taylor in the food nutrition domain. So I was very aware of his scientific work and his publications. When I got married in the 1980s, I changed my name to Susan Taylor Mayne, but still follow Steve Taylor's scientific career. I note, for example, that he was one of the experts on the FAO-WHO Expert Consultation Group looking at precautionary allergen labeling, along with some of our FDA allergen experts.
Very good. I can see how that every time you went to PubMed, you'd pull up everything for you, both you and Steve. That's really great. That's really great. So, and following up on that, how has your understanding of food allergies evolved over the course of your career and as CSFAN director?
So my family is not impacted by food allergies, but in my role at CSFAN, I have met with many families impacted by food allergies. And so the scientific challenges have taken on the faces of parents and children and those families and the challenges they face.
So at CSFAN, and maybe more broadly at FDA, can you share with our community how many individuals are working on food allergy issues?
I'm glad to ask that question because we have so many dedicated staff working on various aspects of food allergies, and I want to give them credit for their hard work, and I want to emphasize our multidisciplinary approach. So let me give you some examples. Our Office of Compliance plays a very large role. Dr. Stefano Lucioli is our allergy expert, and he was very involved with the guidance that we just released. He also is our expert on allergen thresholds, which is a topic I know FAIR and your members are all very interested in. Our Office of Compliance also checks that our allergen labeling requirements are met and does take action when it's appropriate based upon a specific case. We also have labeling experts in our Office of Nutrition and Food Labeling who are very familiar with the various requirements contained in the various laws and regulations that we implement. I hope you've seen Carol DeLima in our video that came out in January that provides an overview of the FASTER Act and the actions FDA is taking to implement its requirements. Dr. Douglas Ballantyne is our expert on Codex for allergen labeling, and he is very involved in the number of allergen-related issues now being addressed by the Commission. The Codex Committee on Food Hygiene is also interested in allergens, and Jenny Scott from our Office of Food Safety is the lead for food safety. And I can't forget our food safety staff who have made sure that allergens are addressed in our preventive controls rules. And of course, our FDA inspectors check for compliance with food allergen requirements. We also carry out methods development in our labs, and our consumer education helps allergic individuals and their families know how to protect themselves. And we have our outreach staff who work with groups such as yours to hear your concerns and to work with you on important issues.
Thank you, Dr. Mayne. So let's turn to something very near and dear to the hearts of many in our food allergy community, and that is the April 2021 passage of an enactment of the FASTER Act. So Dr. Mayne, can you please share with us the progress being made at the agency and at HHS on the requirements embodied in the FASTER Act. What can you share about how FDA and the department are proceeding forward with the report due to Congress in October of 2022? And then following on that, what are some of the topics that will be addressed? And do you believe the fall deadline will be met?
In terms of the labeling provisions, we as an agency do not have to develop any regulations to implement FASTER. It's what they call in legislative jargon, self-implementing. Regarding the report, it is an HHS report, and it will involve multiple agencies, including FDA, CDC, and NIH. One of the subjects most relevant to the FDA that the report must address is our recommendations for developing and implementing a regulatory process and framework that would allow for the timely, transparent, and evidence-based modification of the definition of major food allergen. We are working on the content for the report that is under our jurisdiction, and we are confident that HHS will issue the report promptly.
Very good, thank you. And FAIR also wants to thank you and your staff that in the video you mentioned early on, that your expectation in the video and the Q&A on Sesame allergen labeling and the FASTER Act was that the guidance would be seen around June. So we really applaud that this was able to get kickstarted. We thank you for a generous comment period, and we look forward to commenting and perhaps meeting with you and your staff to talk through some of the things about the guidance. But before we talk more about that, related to just the labeling of Sesame that is due, as you note, by statutory requirement on January 1st, 2023. Our consumers are asking, will food labels be completely updated for Sesame, or will this take some time? And if it will take more time, how long do you think it will take before those who have sesame allergy will feel comfortable purchasing products and ingredients like natural flavors and spices, knowing that if they contain sesame, they would be labeled appropriately to address their food allergen?
The FASTER Act requires major food allergen labeling for packaged food products containing sesame. This labeling is required for foods that are introduced or delivered for introduction into commerce on or after January 1st, 2023. Products that are in commerce before that date are not required to have such labeling, though we understand some manufacturers are starting to make labeling changes now. It may take some time before all products on store shelves have updated labeling, and so I would urge consumers to check with manufacturers of specific products if they're not sure.
Thank you. And that's no different than what we've seen over the revisions to the nutrition facts panel on food labels, that we see some long shelf life items persist in the marketplace, and you can see both a revised nutrition facts panel and the previous one at the same time. So yes, it's really important that for those with sesame allergy, read every label, continue to read every label all the time, and can contact manufacturers to get an update on the status of that. So on a different part, you mentioned Dr. Lucioli and Dr. Jenny Scott. What is being done to prepare FDA inspectors for food manufacturing plant inspections beginning on January 1st and going forward, related to ensuring that sesame is very much covered as part of a plant's food allergen control plans?
Information on sesame as an allergen has been part of our preventive controls for human food regulators course since the bill was signed into law. In addition, we hold quarterly calls with federal and state regulators and investigators about preventive controls inspections to discuss items just like this so that they are up to date on issues and policy. Sesame will continue to be rolled into our training as another allergen to evaluate, just like milk, soy, nuts, etc., for the need for preventive controls. Also, starting on January 1st, we will review and begin enforcement regarding sesame labeling with our investigations and our compliance cases to ensure compliance with the new sesame labeling requirements. In addition to preparing for inspections, we also have some exciting methods development activities ongoing that will help with the Sesame labeling requirements. For example, we have a new XMAP analytical method, which detects 16 allergens, including sesame. We can use the analytical method to check for the presence of sesame in food products where sesame is not listed. This will help provide us with insight on high-risk products.
Thank you, Dr. Mayne. Can you elaborate a little bit further for our audience, specifically what this analytic tool that you've developed is? Is it similar to test kits that have been available for testing for the presence of, say, peanut for quite some time, but one that does it for multiple food allergens? What can you share with our audience?
And that's correct, Bob. I mean, we have a methodology that can detect multiple allergens at the same time. And it was developed for regulatory purposes when we had the 8 major food allergens. And what's been underway now is to expand that so we can detect sesame at the same time we're detecting multiple food allergens. That's really important when we're looking for products to make sure that they are compliant with labeling, that we can detect whether or not they could be containing any undeclared allergens, including sesame.
That's really wonderful news. And, because our community relies on trust, not only by manufacturers in accurate labeling, but also in the oversight that FDA and CSFAN have in making sure that plants are inspected and that food allergens are controlled by manufacturers effectively. So there's a lot of content on FDA's website related to food allergies. There's basic information, and there's also other information and guidance for industry and consumers. So can you share with our community what the status is of updating the overall web content on food allergens to accommodate and include sesame as the 9th major food allergen to be labeled?
Our webpage titled Food Allergies already lets readers know that the FASTER Act has been signed into law and that sesame will become the 9th major allergen beginning in January of 2023. Our webinar is posted and it's available on our website. We are now exploring what communications and educational materials need to be updated to add sesame, and we plan to reach out to consumers at the beginning of the year to let them know they can expect to now see sesame on the label.
You touched on it in your introduction and on your journey in work in the food allergy and food allergen space. So one of the elements of the FASTER Act that was really exciting to our food allergy community was the regulatory framework and process that is to be developed to consider future allergens requiring to be labeled under the provisions of FALCPA. And you issued that on April 18th. So again, applause to FDA and to CSFAN for getting that out early beyond before the June date that you anticipated. So what can you share in any details about the draft framework on how future allergens will be added? And since there's a nice comment period, how can our advocates and us at FAIR share thoughts on this with you?
Yes, we are excited that this draft guidance has published. It does outline FDA's current thinking on the approach we generally intend to take when we evaluate the public health importance of food allergens that are not one of the major food allergens identified by law in the US. The FDA's approach to non-listed food allergens, which is what we call allergens that are not the major food allergens, focuses in on IgE-mediated food allergies, which involve the immune system. They are considered the most severe and immediately life-threatening food allergies. The draft guidance discusses the scientific evidence that establishes a food as a cause of IgE-mediated food allergy and the scientific factors, such as prevalence, severity, and allergenic potency that we intend to consider in our evaluation. The draft guidance also provides the FDA's recommendations for identifying and evaluating the relevant body of evidence to determine the public health importance of non-listed food allergens. and it contains information on how stakeholders may submit requests to the FDA to evaluate the public health importance of a non-listed food allergen. Keep in mind that we would intend to use the same factors and framework for consideration of the public health importance of any non-listed allergens taken on our own initiative. The draft guidance is closely linked to our work with other HHS agencies on the report to Congress required by the FASTER Act. And I need to emphasize, however, that currently only Congress has the authority to amend the list of major food allergens specified in the law. FDA does have the authority, however, to require labeling or other controls for non-listed allergens in situations where that would be in the public health interest.
Thank you very much, Dr. Mayne. Let's switch gears and talk about ingredient flexibility. During the COVID-19 pandemic, there's been a lot of issues with supply chain challenges for food manufacturers. But thankfully, we seem to be getting back to some semblance of what I would describe as a new normal. Children are back in school. Some elements of our pre-pandemic life are returning. But as we approach the 2-year anniversary of when FDA issued its emergency guidance to industry to allow for ingredient substitutions, except when known food allergens would prohibit such substitutions, we still receive questions about it. We're delighted that the guidance has not impacted us, which leads us to wonder, is the guidance still needed? And do you have a sense of when the agency may eliminate it? Finally, if you plan on keeping it, what can you share with us related to the reasons why?
First, I do want to emphasize the point you made that the food allergen labeling has been required for FDA regulated products during the pandemic. The flexibility guidance never gave flexibility on this. We are also still dealing with this public health situation that continues to affect the supply chain and with new variants occurring in the population, so things remain fluid here in the US. And as you are likely aware, China is dealing with COVID surges, and as we have a global supply chain, that can impact ingredients coming from Asia. So we continue to monitor and evaluate the situation, but I don't think we have a clear sense just yet of when we may be past that and the guidance no longer needed. We will provide plenty of notice when the time comes. We don't want to have these guidance documents in place any longer than we have to, but we must continue to support what has been a stressed food supply chain.
And thank you, Dr. Mayne. Our community really appreciates the attention that you're paying to ensure that no substitutions of allergens are made. And it's not just China, it could be any country that supplies products to the United States around the world that can be disrupted. So we're glad that that is being watched. So on another topic, also stimulated by the pandemic, is e-commerce and people buying foods online and buying foods made to order online as well. But we'll certainly talk mostly about foods online that would come in packaged form. So last fall, the agency convened its summit on e-commerce, and we spoke during the summit about the need for food allergen labeling in e-commerce to be as identical as possible to what occurs on the food label. Certainly, the things that are mandatory on food labels, we feel that has to be there. So we strongly believe that the same products that are labeled in grocery stores must be labeled identically when buying them online, whether that be through Amazon or through Walmart or through a supermarket chain. Can you share with our community what are FDA's plans to ensure that this happens so that adequate information is provided?
We want to learn more about the current online labeling landscape and to use our tools to assure that consumers continue to have access to important food labeling information at the point of purchase, no matter the setting. One of the concerns we have had with e-commerce is that consumers may not be able to locate important labeling information, obviously allergen information, but also nutrition information and ingredient statements. This is information that we believe is essential for consumers in making informed purchasing decisions about safe and healthful foods to feed themselves and their families. Unfortunately, we received only a few comments on labeling at the summit, and so we are considering how to better obtain input from stakeholders on this important issue.
Well, certainly if there's anything you need from our community, and we'd be happy to collect and share with the agency beyond what we already have.
Thank you.
So e-commerce is also a global issue. For our viewers today, FAIR works on food allergy issues. As Susan mentioned, she has staff that are deep experts in Codex Alimentarius, which is basically the global food code. And it's a joint effort between the United Nations Food and Agriculture Organization and the World Health Organization. So Dr. Mayne, what is the FDA's position on how global guidance from Codex can help shape and align with the agency's US approach on e-commerce?
As you noted, FDA is an active participant in the Codex Committee on Food Labeling, and we are also the head of the US delegation. That person is from FDA. US positions advocated in Codex are informed by science and alignment with US policy. The work on guidelines for labeling information in e-commerce, including allergen disclosure, that's in early stages, both at FDA and at Codex, which should enable general alignment. The US position is that allergen disclosure should be provided for e-commerce transactions.
Another global issue, you mentioned earlier, Dr. Lucioli, who's the lead person in CSFAN that is the lead on food allergy. He's a member of the FAO and WHO ad hoc expert consultation that's helping inform the issues of priority food allergens and thresholds and precautionary allergen labeling. So on the topic of thresholds, you know from what you've seen from our food allergy consumer journey study that was published in 2020, that our community is frustrated with the number of precautionary allergen labels in the marketplace. We know that Codex is working on this and being informed by the work of the ad hoc group. So how does Codex viewpoint on this help shape FDA's thought on the subject? Because they've put a lot of strong intellectual and research-oriented work into the summary reports and now the full reports that are coming out of the expert group.
The Codex Committee on Food Labeling is working on guidelines for precautionary allergen labeling. The US positions to shape Codex labeling guidelines on this issue will be based on sound science and will align with US policy. It is our hope that Codex guidelines will generally reflect the US views as they will be forming over a similar time frame.
So as we think about the issue of precautionary allergen labeling or PAL statements on food packages, what do you see in tandem with that thresholds are important as part of this whole litany of issues related to food allergen labeling, priorities, et cetera? So what does FDA see related to and think about the positivity of developing food allergen thresholds, similar to what's in place already in the VITAL program in Australia and New Zealand?
Yeah, a couple of remarks on that. The first is that the use of these allergen advisory statements, as you referred to precautionary allergen labeling, that's voluntary. The FDA doesn't require the use of such statements, nor do we prohibit them. However, as with all labeling statements, they must be truthful and not misleading. And importantly, they must not be used as a substitute for good manufacturing practices. And you've asked me about the VITAL program in Australia and New Zealand. As of now, the FDA has not established thresholds for any major food allergens. However, this does not mean that we do not consider information related to allergen thresholds in our regulatory work. For example, the FDA may consider allergen threshold data in assessing the safety of ingredients exempted from FALCPA allergen labeling requirements. We continue to monitor and evaluate new science that has emerged in the past decade on population threshold dose response to a variety of food allergens. Importantly, we are aware of more recent international discussions, not just FIDAL, but also a recent FAO-WHO consultation on thresholds that both of us mentioned in our remarks here today. We understand that final reports from this consultation will be coming in the coming year, and our scientists have been looking at this information closely.
Thank you. So lastly on this topic, some people in our community have expressed support that maybe Congress should take a role and get involved with providing FDA with authority to regulate PAL statements on food packages. Do you have any thoughts that you can share with our community about this approach?
Should Congress decide to take a role in developing legislation around allergen advisory statements, we will, of course, be happy to provide them with any technical assistance that they may request.
Okay, very good. So in wrapping things up, Dr. Mayne, we can't thank you enough for being with us today and for your and CSFAN's and FDA's leadership and dedication to helping the food allergy community. So we want to give you the last word, and you can add to it if you want. Is there anything else that you would like to share with our community about what FDA is doing or future projects that will have interest to us?
I'd say these are exciting times, and there are many opportunities for us to do more in the food allergy arena. We have requested an additional $3 million for allergen work in the President's FY23 budget, and we do want to thank you for the support for resources. Of course, we look forward to continuing to work with you. As we noted, we do have a new draft guidance out that we hope your members will take a look at and give us comments on. We benefit so much from the input of our stakeholders, including FAIR, and so we look forward to continuing to work with you for the benefit of families that suffer from food allergies.
Well, again, thank you, Dr. Mayne. We definitely will be in contact with the agency and will be making comment, and we want to support, whether it be with the draft guidance for considering other allergens that need labeling, to helping assist with data to move forward with thresholds as things can proceed. So we really greatly appreciate you being with us this morning. Thank you again so much for joining us, and we want to move forward and continue to hope that our community is protected with all of the regulations and actions by FDA and by CSFAN. So again, thank you very much again, Dr. Mayne.
Thank you. It's been my pleasure to be here with you today.